Hi, my name's Haley. I'm here to talk to you about starting Max on Simparica Trio. Is that okay? Alright, so I just have his file here that I'm just going to be referencing what we discuss. So it's used for flea, tick, and heartworm preventative, and it also prevents roundworms and hookworms. So if Max goes outside a lot, does he go outside a lot? Yes, he loves it outside? Okay. So this product would be really great for him because ticks, especially in the area that we live, are very popular and they're going to be attracted to Max. They're going to want to go on him. So starting him on this preventative, it would prevent the ticks from doing just that. So he would be protected from Lyme disease or just if he got bit, and then fleas. Fleas can be really bothersome to animals because they just make him itchy and they're just there. They're a burden for him and for you. So Simparica Trio would help prevent these. It is safe for dogs 8 weeks old and 2.8 pounds or over. So Max fits this category since is he around 2 years old? Yeah, okay. So this would be great for him. And so it works by, it releases GABA receptors, and that leads to insect death. And then moxidectin it interferes with neurotransmission, and that leads to death and lysis of parasites. And then pyrantel pamoate also involves parasites, and that leads to parasitic death as well. So there are 3 active ingredients in Simparica Trio, and that is ceralanar, moxidectin, which I just mentioned, and pyrantel pamoate, and they all work together to help prevent fleas, ticks, and heartworm. So it makes it different from other preventatives. I'm sure you've heard of a bunch of other preventatives because most of them are just flea and tick, and there is just Simparica, and that does just prevent flea and ticks. But Simparica Trio we like here, especially at the clinic, because all 3, fleas, ticks, and heartworms, are prevented, and it's just a little tablet, a chewable tablet you can put in with his food. You can use a pill pocket if he doesn't like taking pills. We have them here if you would like some. You just stuff it in the pill pocket and then he eats it. So it's a way of hiding this chewable. Did you have any questions so far? Anything you want to go over? The cost? That's a great question. So compared to other over-the-counter products, because with Simparica Trio you need a prescription from a veterinarian, which we would be happy to supply you, it can run a little bit expensive. I'm going to be completely honest, but that all depends on the size of the pack that you get. You can get a 3-pack, which comes with 3 chewables, and that's around $40. But if you want to say get a 6-pack, so that is 6 chewables, and you would be covered for 6 months because you would give Max 1 each month, that's around $108. So that could get on the pricier side, but we do recommend getting the 6-pack just so you're covered for that half a year. For storage, you don't have to refrigerate or anything. The box that we would give you, you can just keep it right in the box, and it comes in little push-out tabs, so you can just keep it in the tabs until you're ready to give it to Max. So, like I said, you give him 1 tablet monthly. You can do with or without food. You can use the pill pockets that we talked about. And there are different size tablets based on his body weight. So, the smaller the animal, the smaller the tablet. And then the bigger the animal, the bigger the tablet. There are a few contraindications for Simparica Trio. Seralanar, which is one of the active ingredients that I mentioned earlier, one of the 3, it has been associated with tremors, ataxia, and seizures. So if Max, along the way, I know he's completely healthy right now, but if along the way he developed, say, seizures or any other problems like that, you would have to come in and we would talk about switching him off, because it wouldn't be healthy for him to be on it with those seizures. And then just like any other supplement, drug, preventative, there are a few side effects. The most common have been linked to vomiting, diarrhea, and lethargy. So the most common side effects have been linked to vomiting, diarrhea, and lethargy. You can also experience a bit of itchiness, but these side effects aren't long lasting. So since he's never started Simparica Trio, he might experience all of these side effects, some of these side effects, but they will end up going away. So that was all for my little spiel about Simparica Trio. I think Max would be a great candidate for this preventative. So do you have any questions at this time? Anything else that you'd like me to go over? You'd like to get him started. Okay, great. So I can get you taken care of right here, and we can discuss what pack you want, a 3-pack or 6-pack, and then we'll get you all checked out, and you and Max will be on your way.